Hello, this is On Call with Doc Dave, and this is episode number 3. And today I'm going to talk about a common entity that a lot of people have and may or may not understand what the actual disorder is. It's called asthma. Now, there's two different types of asthma. There's an extrinsic asthma and an intrinsic asthma. The extrinsic asthmas are by far the most common. Maybe 80-90% of your asthma is caused by extrinsic factors. And what are extrinsic factors? Well, triggers for extrinsic asthma are generally like pollens, which everybody knows, mites, dust mites, any kind of animal danders, maybe you're allergic to cats or dogs, pollutants in the air, which is quite common in certain areas. Exercise sometimes brings on the bronchospasm, and any kind of maybe occupational exposures. Also, some types of foods bring on extrinsic asthmas, like milk, soy, wheat, eggs, fish, and nuts. Those are generally the most common. Now, extrinsic asthma, I won't get into the details, but it's generally caused by hypersensitivity of some type of an external inhalant, which causes bronchospasm and increased mucus production, which will make you shortness of breath, and then you'll hear audible wheezing and this and that type of thing. You may have a little bit of a yellowish, greenish productive cough, and it can be quite disabling. So what do you do to treat this? Well, it's pretty simple. Simple things that you can do are like hydration. Keep yourself well hydrated so the mucus buildup can be liquefied and expectorant. Other things are, rest when you get it. Don't over-exercise. Don't, cause your heart rate to go up and your breathing pattern to go up, and therefore may exacerbate the asthma attack. Antihistamines, things like Benadryl and over-the-counter medications are moderately effective decongestants. But the most important thing, and it's a prescription from your doctor, and this is what you should always be doing and following directions of, is a bronchodilator inhaler. And it's an albuterol, usually the most common one. Ventilin's another name for the same type of medication. And it's a beta-adrenergic blocker, and it gets rid of the hyperreaction that you're having to whatever external stimulus is precipitating your asthma. So bronchodilators, you should always kind of carry one around in your pocket, as you know. Usually you do 2 puffs, maybe every 4 hours. You don't want to overuse it, because if you use it too often, then it's going to cause some tachycardia, high heart rate, and get you anxious and jittery and things like that. So you kind of want to only use it when you absolutely have to. And if you're using it to the point where you have to use it every hour or every 2 hours, then you probably should contact your physician or go to an emergency room if it's getting more severe, because the treatment you'll get in the emergency room is immediate corticosteroids like prednisone or some type of a shot that has a corticosteroid in it. And that's very effective. That'll clear the asthma generally within an hour, and depending on what type of corticosteroid, it'll last for weeks. Or if you take the dose pack of the prednisone over 5 days, that'll not only stop the immediate reaction, but it'll clear it out of your system over the next 3 to 4 days. So those are things that you should know. You probably already know if you do have asthma, but if you're new to asthma, this is how you generally treat it. And they generally don't recommend the inhalers until you're at least 18 years old, although they do have some pediatric puff doses of inhalers as well. Now, what is intrinsic asthma? Well, intrinsic asthma is a little bit of an odd disorder. Most people don't have that. 10-15% of the people that have asthma have intrinsic asthma. And it's an internal stimulus in your body. It could be, family history of this. You have too many of one type of cell in your body called an eosinophil, which is an IgE. And you can test that by blood test or mucus testing. And something in your internal system, not an external stimulus like extrinsic asthma, will stimulate this, either a virus or something in your body that you're reacting to, maybe even a bacteria. And it's generally not that effective with inhalers, although inhalers can help to some degree because it produces a similar type of bronchospasm as your external environmental asthma causes. So these are the things you should know about asthma. It's pretty straightforward. You should always have your physician involved, and you always have urgent care or emergency room if things get to the point where you're not getting immediate relief from your rescue inhaler, your albuterol or Ventolin inhalers. So I hope you enjoyed this. There'll be many more informative podcasts in the near future. If you like it, you like it. If you don't, let me know. Email me. My email contact is oncallwithdocdave@gmail.com. I can always respond to you that way if you need any more in-depth information on this. Or if you got something you would like, a topic you would like me to discuss in the near future. So I'm always available, but remember, I'm your friend, not your doctor. And thank you for listening today and your time.